Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and it's great to be back in the Sunflower House. On today's Speaking of Women's Health podcast, we're going to talk about the 3 stages of menopause, because every woman knows that menopause is in her future, and every woman's experience with menopause is different. One person might breeze through it, barely realizing it's happening. Others may suffer from debilitating symptoms such as depression and hot flashes and night sweats and insomnia and anxiety and skin crawling and hair thinning and dry skin. One woman might acutely feel the effects of the fluctuating perimenopausal hormones. Another one might still be having monthly periods at 56 or 57. So, how do you know when the change is happening to you? And more importantly, how do you know when the change is over or you enter into menopause? You never go through it, because once you stop making eggs and losing your estrogen, you're in postmenopause and your ovaries are never going to start working again in terms of making estrogen. Now, the ovaries still do make some hormonal substances, and there appears to be a survival advantage to keeping your ovaries to age 65 unless you have a genetic predisposition to breast and ovarian cancer. So there are some telltale signs to kind of make you a bit aware. I really think that the anticipatory guidance of perimenopause and menopause and postmenopause is completely lacking. I think that girls get preparation for menstruation and monthly cycles and gynecologic care and pregnancy prevention and delivery and lactation. But then it's like a dark black hole. And so we at Speaking of Women's Health aim to fill that gap. So stage 1, perimenopause, is getting ready. Since your early reproductive years, your ovaries have produced a steady supply of estrogen, progesterone, and testosterone, those 3 key hormones. And each hormone plays a role in your reproductive system, but estrogen's always the leading lady. She's regulated your monthly cycles, affected your well-being, sleep, mood, sex drive, helped the function of your urinary tract, skin, bones, heart, neuronal activity in your brain, and more. So during perimenopause, estrogen begins to withdraw, and the steady cyclical mix of hormones is disrupted. And that's when things can get a little wild. Periods may become unpredictable, closer together, heavier, or farther apart. Other strange symptoms that you might never have experienced, like hot flashes, the sudden sensation of heat that spreads from the chest to the head, following by sweating or shivering. You may have hot flushes where you turn red in the neck and face. I see this every day in my office. Night sweats can occur, which cause perspiration and may wake you up and need you to change your bed sheets and nightgown. Difficulty sleeping, which many times can be related to the hot flashes. There can be changes in the vagina, dryness, also changes in the bladder because it's derived from the same tissue, with increased risk of bladder infections. Mood changes can happen secondarily because of lack of sleep. With loss of progesterone, there can be more anxiety. With hot flashes and discomforts, there can be irritability. There's a natural reduction in sex drive in many women when they get past the reproductive stage, since that's the reason you have a sex drive, is to help you to reproduce. But it can really come to a crashing halt and almost become impossible to be sexually active if you have significant atrophy, thinning, changes in the genitourinary system that we call genitourinary syndrome of menopause. Some women notice skin changes. Some are happier, less acne, less oily skin, but others might have dryness and harder to heal skin. Headaches and migraines may flare up when you're in perimenopause and the hormones are fluctuating. The fluctuating hormones can cause heart palpitations, And that's simply a manifestation of hot flashes in the autonomic nervous system, which are the nerves that affect blood flow to the arteries. Now, before attributing palpitations to menopause, you need to see your physician, get a blood pressure check, get a cardiac evaluation, perhaps a baseline EKG, thyroid testing, chemistries, blood count, because we don't just ascribe cardiac symptoms to menopause, but in a healthy woman who's been evaluated, who is clearly perimenopausal, many times prescribing menopausal therapies will make those symptoms, including palpitations, go away. Some women notice more hair on the face and thinning of the hair, especially in the temporal areas and the top of the head, the typical male patterned or female patterned hair thinning, which typically runs in families. And I just did a podcast on hair and everything you want to know about hair thinning on Father's Day in June. Forgetfulness, poor concentration can be linked to yo-yoing hormone levels, lack of sleep, and increased stress. Now, usually perimenopause begins in a woman's 40s, classically age 47. It can be much earlier if you're destined to go into menopause earlier. And it can last as long as 10 to 11 years. And the longer that it lasts, the more disruptive it is. Some women don't have any symptoms. They just have a monthly period that, boom, just stops. And they may or may not have significant symptoms afterwards. It depends on many situations, your adrenal reserve, your genetics, your diet, your other medical comorbidities, your family history. So it's very individualized. And some women feel great. Like they make an appointment, it takes a while to get in to see me, they're feeling miserable, and then all of a sudden they start to feel better right when the appointment comes. Still keep your appointment, because if the hormones are stabilizing and not sputtering, at that point in time you may feel fine. But it is going to be definitely a fait accompli that your ovarian function will end. And then estrogen plummets, and women have lower estrogen levels than men who are older than them. How is that fair? So menopause transition is actually that first 12 months without an ovulation or resultant period. Now, if you don't have a uterus because you've had a hysterectomy, or you've had an endometrial ablation that takes away the endometrial tissue or most of it, or if you have a Mirena IUD, which has levonorgestrel, which causes atrophy of the lining of the uterus so there's no bleeding, that doesn't mean you're in menopause. It's not just the menstrual cycle. It's really the hormonal situation. So if you cannot rely on monthly periods to kind of assess your ovarian activity, then you need other evaluations, symptoms, labs such as FSH and estradiol, the anti-Mullerian hormone factor, PICO, AMH, is sometimes done. Usually menopause comes between ages 45 and 55, but anytime between 40 and 60 is the range. Some of it's genetic, so you need to find out about your blood female relatives when they stop their periods. Now, certainly lifestyle, medical history are factors, so smokers, women with chronic illness, seizures, depression, anyone who's had any chemotherapy, any procedures to the ovaries may reach menopause earlier. So stage 3 is postmenopause, a new beginning. It's kind of like your second adulthood. Once you've wrapped up and completed the reproductive years, whether you've had children or not. The first 5 years of postmenopause begin on that 13th consecutive month without a period. And this is really critical in terms of symptoms and rapid trabecular bone loss. During this time is when women usually initiate hormone therapy if they need it. And certainly it's best to get the preventive benefits of hormone therapy to start within 10 years of menopause and or under age 65. But if you have a late menopause and you don't have symptoms, I do see women in their later 60s that we do start hormone therapy on if there's indications. It's just that generally speaking, not waiting several years where you lose and acetylate the receptors, the estrogen receptors in your body, you have more of a response. So if you're struggling with symptoms of the change, or you just don't feel like your old self, please see your physician or your nurse practitioner or physician assistant for at least an initial evaluation. Millions of women have found relief with hormone therapy, which is really misunderstood and vilified. And it certainly is kind of the gold standard FDA-approved treatment for menopausal symptoms. However, we do have other FDA-approved options to treat hot flashes. We've had Brisdel, which is low-dose paroxetine, which is a non-hormonal SSRI, which helps reset the thermostat in the brain. And the newest addition, first-in-class medicine, is Veozah, fezolinetant, 45 milligrams daily, which is a KNDy neuron antagonist. It affects the brain thermostat level, and it's dosed 45 milligrams daily with liver functions checked every 3 months for the first 9 months because it's metabolized in the liver. We have a whole panoply of things that can treat the vagina and bladder, hormonal and non-hormonal, and I have given podcasts on this topic, including for breast cancer survivors. Bone, which is lost in 50% of women, we have hormonal and non-hormonal options to treat and prevent osteoporosis. And I've done several podcasts on these topics. In fact, I've podcasted an updated version of my book, The Cleveland Clinic Guide to Menopause, which really goes into all of this in deep depth. So when you start on menopausal hormone therapy, it's usually a combination of estrogen, which does all the good things, and progesterone, which protects your uterus or endometrium. If you don't have a uterus and you didn't have endometriosis, then many times you just need estrogen. Women ask a lot about testosterone, and we'll do a specific podcast on testosterone alone. But the ovarian stroma still continues to make testosterone. So most women, unless their ovaries have been removed, generally don't need testosterone. But we do evaluate it and we can prescribe it off-label. Now, there's a lot of different ways to give estrogen. Pills, which go through the stomach and liver, creams, gels, sprays, which bypass the intestines and liver, patches, which give a little more consistent estrogen levels than sprays and gels, vaginal rings. One string is just local, and then there's another one that comes in a couple doses, FemRing, which also not just treats the vagina, but gets into the whole bloodstream. I do not recommend pellets. Neither does any major medical society or the FDA. And they seem to be very popular amongst women because there's plenty of folks out there who will take a lot of money and then just inject something under your skin in your butt. And a lot of times it's a lot of testosterone, more than what a woman needs. And that burst of testosterone a lot of times takes away some of the menopausal symptoms, makes the woman feel like she can just take on life and transiently have an increased sex drive. But it's not physiologic, and the levels go up and then they crash. I've seen women with endometrial hyperplasia, hormonal imbalance, and a lot of women coming into my office, they get tired of paying the money, having the ups and downs and yo-yoing of the hormones. And any woman who's taken unregulated hormones has an increased risk of uterine cancer, and that persists even if you stop the unregulated therapy. So it really behooves you to see someone who's interested and has expertise and who's trying to do what's right for you, not sell you something or make a quick buck. I mean, I'm all for, the free market and people making a living, but not at the expense of your health or unproven, unethical treatments. So whether or not you need hormone therapy or not, menopause is a natural phase of life and a natural part of aging. So it's not a disease. And a lot of women welcome it because they know that change is good. They are happy not to have periods or worry about pregnancy. They're happy to not have painful periods, PMS, low iron levels. However, it can be a potential endocrinopathy, and it can lower levels and increase risk for several diseases. And I tell women that the average lifespan of a woman is like 50 to 55, and people's eyes just bug open. And they're like, well, wait a minute, my mother's 75. Or wait a minute, I'm just starting my life. My kids are raised. I've hit my stride at work, or I've just really settled into a good niche in what I'm doing with my community and my hobbies. And they don't want everything to fall apart. It really is unfair. I think I got interested in this field when I would see women kind of at the top of their game coming in looking like pretty but wilted flowers. And having such delicate, dry vaginas. And so, if you have symptoms, if you need treatment, some women need treatment for the symptoms, for the bones, for the genitals, and want the preventive aspects. Other women don't have any brain symptoms, but they have bone symptoms, and maybe later down the road need something locally for the vagina. Other women have no symptoms in any of the domains until much later. That's more unusual. At least half of women have significant symptoms, and half of women rapidly lose bone. One size does not fit all. A woman's preferences, her list of other medical concerns. Some women want to just go with diet and exercise and nutritional supplements. And that's fine. However, if there's serious suffering, if there's lack of ability to function, if there's definite tissue documented changes, I liken it to if you were told that you were low in thyroid and your thyroid gland had failed. Yes, you still want a healthy lifestyle. Yes, you want to eat right. Yes, you want to have a vibrant life and not medicalize it. However, if your body wasn't making thyroid, you would have to take thyroid. If your body wasn't making insulin and you had type 1 diabetes, you'd have to take insulin shots or get a new pancreas. We are not in the business of giving ovary transplants. So even though it's normal and natural, there's a lot of things that are natural that we don't necessarily want, like hurricanes and manure and death, and even death in childbirth. Up until recently, 1 in 50 to 1 in 100 women would die in childbirth. And I am so happy that we have advanced obstetrical care, even for healthy women. My two daughter-in-laws recently gave birth and had nice, smooth, safe delivery, so much so that that's what we expect, but that's not what the history was. And when I have women in my practice upset and kind of dejected that they have all these symptoms and they can't believe what happened to them and they feel like a shell of their former self, or some who just come in because their sex life has dramatically changed. And then I ask them, well, if you were a nun or you weren't having sex, would you be here? And they say no. And I'm like, oh, but you need to be here anyway, because we need to look at the whole body and the whole person. And many are distressed if they think they need to go on treatment. But I say, hey, cheer up. It's 2023. If I was seeing you 200 years ago, we would just only be able to offer you ground up animal gonads as hormone replacement. So we've really come a long way. And part of being strong, being healthy, and being in charge is anticipatory guidance, being proactive, looking at all your alternatives, and getting a complete menopausal risk assessment by someone who focuses in on this. It's also critically important that you get the right information. So much out there is completely inaccurate and just blatantly false. Women think if they take hormone therapy, they're going to have a shorter lifespan. It's actually the opposite. They're going to feel better, look better, and live longer. So I'm always saying, I hope you're saving for retirement. I've got women in their 80s and 90s traveling the world just doing marvelously. So while it's fine and it's appropriate to embrace different stages in life and not try to be a teenager or a young adult, and also not to expect your body to be the same as it was when you were 30, you're going to have a lot of benefits, wisdom and experience, and potentially other reserves, whether it's social or financial or occupational. However, it is important to be medically assessed. And for women with blood clots or cancer or serious medical problems, autoimmune diseases, for sure women in those situations need to seek out an expert. However, even just healthy, regular women should get educated. So please use our speakingofwomenshealth.com website. We have town halls and virtual events. We have free treatment guidebooks. We have all sorts of fun social media. I've podcasted my book, The Cleveland Clinic Guide to Menopause. And we have lots of ways to figure out different options for you. So if you enjoy this information, this has been helpful to you or a loved one, please subscribe to our podcast. It's free. Anywhere you get podcasts, Google Music, Apple, iTunes, Stitcher, Spotify, Podbean, any place that you have an app which is free to listen to free podcasts, just put in Speaking of Women's Health and hit subscribe. And please give us a 5-star rating. And I'm looking forward to you joining me again in the Sunflower House. This is your host, Dr. Holly Thacker, signing off for this episode on Menopause, the 3 Stages.